Welcome back to part 2 of self-care, safety, and the workplace for nurses. So we left off talking about a number of the risk factors or the hazards within our workplace here in this foundations course and understanding how do we protect ourselves. The last topic that we were talking about was violence, and specifically the violence that is possible that a nurse could encounter while attending to care of his or her clients or moving about the facility. And then we identified this list of risks and who may be at greatest risk and those places where we most frequently see violence in the workplace. Understanding that violence definitely does have an algorithm, if you will, or as this pictorial depicts, the cascade, right? So we have oftentimes we can see where it's escalating to the place of violence. So very practical point in this discussion is that what nurses can do to, because this is about self-care, this discussion, what can we do to help keep ourselves safe, and that is be familiar with those indicators that it's escalating. So there's actually a term for this, and you'll learn this likely in your mental health course, but it's de-escalation. So you can see here that oftentimes incivility can be one of the early indicators. So we're not even certain that the person wants to harm us, but there's definitely an incivility. The person's unruly, being difficult to talk with or reason with. And then we start to see the sometimes non-physical violence, which is, bullying or name calling or cursing and cussing. And then that can sometimes give way to physical violence where somebody intentionally can hurt another individual. Another pictorial shows that there are actual phases of violence, and that is where somebody can move from feeling normal or calm to being to basically like pre-assault phase, which basically they start to become threatening, and then they move on to the assaultive phase where they actually can become verbally and physically aggressive. So nurses paying attention to those phases would want to seek assistance and help if they thought it was escalating. So, what can we do? First acknowledge that it happens, and then acknowledge that we have to have no tolerance for workplace violence in the workplace. That is not acceptable. No nurse should ever be in harm's way. We have to make sure that there's an awareness around us, that not only do our colleagues and our administrators know, but also those people who frequent healthcare as well. Knowing how to recognize that escalating situation and then therapeutically attempting to de-escalate it and get the help that we need. Diffusion, right? That's a term that you may hear, to diffuse away from the situation. And then as soon as something is happening, we get help. The next hazard that we can talk about today is the hazard of being exposed to electrical, is that a bug there? Electrical hazards, and in particular, that would be like equipment or cords that are not properly operating. So, perhaps exposed wires or equipment that sparks. And basically what that means is we're always paying close attention to what we're using. And certainly because we have a biometric team and also an equipment, many institutions have folks who are certified to check equipment. Patients can't be bringing their own equipment in because it's not checked by anybody else, and it could hold a hazard to us. So as soon as we see any kind of equipment that is not working properly or appears to be a hazard, we would discontinue use, label it as such, and then follow the institution's policy to remove it from the area or the care area, patient care area. Next injury we can talk about would be that needle stick that we talked about. And it's not just needle stick. It could be, if you work in the OR, scalpels, knives, scissors, clamps, forceps, anything that could injure or harm the body. But when it comes to needle sticks in particular, and this is really more about awareness, this is the nurse who is receives an unintentional stick from the needle. You can see that 80% of the sticks are either during or right after the administration or the use of the needle itself. So we would call that a tainted stick, right? This is a case where it could have already been in contact with another human, which then it comes in contact with our skin, and it does open up a whole array of risks for us as healthcare professionals. Notice that 20% would be either I'm sorry, that 20% has to do with disposal. So, 15% disposal, 5 other. So again, knowing if it's already come in contact with a patient, that there's the greatest risk. If we're stuck with a clean needle and has nothing in it, it's simply just that. We don't have an OSHA risk. It's just, it hurts, but it's the needle that has med in it and that we're using for a patient that becomes the risk because of transmission of disease. And then the last thing to talk about, and we already talked a little bit about this earlier, because we do know that exposure to radiation can certainly, over the long term, cause harm to our organs and our immune system, and can change our risks for things like cancers. So it's time, distance, and shielding. And that is that we would never spend more than 30 minutes of continuous time in the patient's room. If we're within 6 feet or closer, we have to have protective shielding on. We must have a dosimeter that measures our time. And we would not assign pregnant women to a patient who is undergoing any kind of radiation. That concludes the first part of this 2-part series of self-care. This has been the self-care, protecting ourselves from harm video. The next video is also on your Moodle, and it is self-care and stress management and coping. I'm going to move to that now. I will pick up with a next video.